My name is Dr. Rekkas. I'm a general and bariatric surgeon that specializes in robotic surgery, and I wanted to talk today about obesity, its implications, how to treat it, and why I think it's a very important topic. So, in order to understand obesity, there's a long history, and there's multiple tools and things that are available nowadays, now more so than ever. And I wanted to kind of go with a brief overview of how obesity trends have changed and different ways that we can treat it. I'm a surgeon that specialized in bariatric surgery with a fellowship training, and I have a real passion for weight loss surgery and helping patients get healthy. Um, I can tell you things really have changed when you talk about the last 20 or 30 years in medicine. We used to think that when patients were overweight, it was their fault, and we used to just say, go diet and exercise more. Now we really treat obesity the way it should be, in my opinion, and that's treating it like a disease, because we know that it has serious effects when obesity is not treated correctly. It can really impact our patients' lives. Again, we used to think diets and exercise were the only ways of treating. Now we know that there's medications, there's help, there's surgery out there that have been proven to be very, very safe and effective in helping treat patients with this obesity epidemic. Again, we used to think that surgery was a very extreme thing and a dangerous thing. Now we're doing surgeries with a one-day hospital stay with complication rates of 1 and 2%. So again, there's different strategies, there's different reasons for this, so let's go ahead and get into it. We really do have something called an obesity epidemic worldwide and especially in America. We know that obesity is the second leading cause of death only after smoking when you look at how people die and death per year. The numbers are quite staggering, and it really isn't until the last 20, 30 years that we really started to treat this aggressively. We know that obesity affects millions of Americans. Well over 200 million Americans are obese. We know 67% of Americans are overweight, and it's predicted that about half the population will be obese by 2030. It's important because obesity increases health risks such as diabetes, heart attack, stroke, and early death. Over the past 20 years, the obesity numbers have doubled. It's quite amazing, and there's many things to blame for it. But really, something has to change because the current way we're heading, things are getting really out of hand, and it's impacting millions of lives. So ultimately, why do we care? We know obesity leads to chronic diseases, and those diseases lead to death. And on average, we expect people to live about 5 to 15 years less that are overweight. The amazing thing is that when patients get healthy and lose that weight, they get those years back. When you talk about obesity, there's certain terms that we talk about. One is morbid obesity, and another is BMI. So BMI is a number that's calculated by your height and your weight. And on average, when you're over 100 pounds above your ideal body weight, you're classified as being morbidly obese or having a BMI above 40 or a BMI above 35 with medical comorbidities. And again, about a third of the population in America is morbidly obese. We really have gotten out of control when it comes to food choices, food availability, how we eat, how much we eat. It's really changed, and there's so many reasons for this, and we're still trying to figure out how we got to this point. But a lot of this has to do with the availability of food and the portion sizes. If you go back to the 1900s, for example, when the Hershey's bar first came out, there was only one size. It was 2 ounces, about 300 calories. Now it's normal to eat a Hershey's bar that's about 7 ounces or 3 times that calories. Again, the size of Coca-Cola used to be only 6.5 ounces. Normal size nowadays is about 16 ounces. So we're tripling the calories and the portions in so many of our food choices. There used to be one hamburger available. It was about 2.8 ounces or 200 calories. Now you can go to a place in Las Vegas called the Heart Attack Grill, and they specialize in a 24-ounce cheeseburger that's over 20,000 calories. So again, what's the price of obesity? It's very easy to see. Type 2 diabetes, heart attack, stroke, sleep apnea, asthma, depression, multiple cancers. The list goes on and on. So there is, unfortunately, a big price to pay for our patients that are overweight. On top of that, we don't talk enough about the mental health aspects. We know that our obese patients have lower self-esteem. There's a social stigma with being overweight, and rates of depression skyrocket in our morbidly obese patients, with up to 90% of them being morbidly obese. And there's so many things that go into diets and exercises and why people can't lose that weight. So let's get into that. We know that there are multiple genetic and hormonal changes that prevent diet and exercise from working by themselves. So it's a cycle that happens. People try to get on a diet, they try to lose weight, but unfortunately their body has a set point and they just gravitate back slowly. So what can we do? How do we lose weight? What are the options? Unfortunately, we've seen every fad diet that comes and goes. Let's talk specifically about what we can do to try to fight this obesity epidemic. Initially, we have nutritional therapy, increasing physical activity, behavioral therapy, hypnosis, medications, and really combining all of the above. The first question is, why isn't it so simple that a diet and exercise program works for everyone? The truth is that when the body senses change, the body reacts and it defends against initial weight loss. Your thyroid hormone actually slows down your metabolism when you start to go on a diet program. You have certain parts of your body and hormones that trigger your body to store more fat. In addition, you have this hunger craving that happens because your body's saying, hey, I'm used to a certain amount of calories, something's going on. And unfortunately for most patients, it's impossible to stay on a diet long term. That's why we have very high failure rates. So we used to think that, just eat less, go exercise more. Now we know that there's a whole different thing going on. There's genetics that play into our patients' obesity. There's hormones, and really diet, exercise, and lifestyle changes are part of what we can offer our patients nowadays. So really, it's a very complex thing that happens with your brain, with hunger. So you're hungry, your body ends up storing calories more effectively. There's hormones that come into play. When you go on a diet, you get more hungry. And it just really is a whole hormonal cascade that we now are just beginning to really understand. So obesity is not just patients not wanting to get healthy and not exercising and eating too much. It's a very complex thing. When you talk about different weight loss strategies, most commercial weight loss programs like Weight Watchers and Jenny Craig, we can expect about a 2% body weight loss. There's many medications that have come and gone, such as phentermine, sumatriptan, which was pulled from the market, fen-phen. Now the new drugs out there are semaglutide and GLP-1 agonists that show some promise. Again, at most, these medications can have about a 15% weight loss reduction. Surgery is a proven and effective method that really can't come close and exceeds what is available with medications. For example, a lap band has about a 20% weight loss reduction, a sleeve gastrectomy about a 25 or 30% weight loss reduction, and a gastric bypass about 35%. Of course, the benefits of surgery is it's one procedure that's done and doesn't need any real maintenance except for lifestyle changes and some multivitamins. The problem with most of these medications is cost, availability, and long-term side effects and data. So weight loss surgery is an option. Weight loss surgery is not an option for everyone, but for someone that has tried, that understands the importance of making changes, it can be a life-changing thing. We know now in 2024 that surgery has really gained worldwide acceptance as the only real method to treat and ultimately try to cure obesity. Three main surgeries are mostly talked about now. That's the adjustable gastric band or lap band surgery that has really fallen out of favor in the last probably 15 years. The two most common surgeries are the Roux-en-Y gastric bypass and the sleeve gastrectomy. So lap band surgery was a very promising procedure that came out many years ago. Only about 2 to 3% of surgeons still offer this, and the reason is it doesn't really change your hormones, it doesn't change your metabolism, it basically restricts the amount of calories that you can eat, and when patients overeat, they get nauseous and they tend to vomit. Unfortunately, there's some very high failure rates of this procedure, 8 and 10 years down the road, but for some patients, it can be a good option. The most common surgery that used to be performed was a Roux-en-Y gastric bypass, which is a wonderful procedure. It does have a long track record. It does decrease hormones. It has tremendous improvement in patients with type 2 diabetes and improving their metabolic syndrome. The problem with this surgery is it can be a very complex surgery. It involves cutting the stomach, making it pretty small, about the size of a football. We're going to the size of a golf ball, and we move the intestines around in a couple spots. By doing so, we decrease the amount of calories that a patient can eat, and we also decrease the absorption of food. Wonderful surgery, but on average it has about a 5% complication rate. The most common surgery performed now is something called the sleeve gastrectomy that's been ongoing for about 24 years. In this procedure, we don't touch the intestines. There's no foreign body that goes in, but we just remove about 3/4 of the patient's stomach. There's no reconnecting of the bowel, so all calories and all food are seen and absorbed the same way in the small intestines and large bowel. The thing that we do see with this, there's about a 3 to 5% increase in reflux in some patients. The secret with this surgery is a hunger hormone called ghrelin that really impacts patients' sense of hunger. Their cravings for food tends to get diminished. So after surgery, they eat a small amount of food. They get full because they have a restricted stomach. But also we find that the cravings for food tend to go away dramatically. All the procedures that we perform here are performed robotically. Traditionally, surgeries used to have large incisions involving cutting the stomach wide open. Everything that's done in our program is done robotically with usually 5 small incisions, which improves patients' pain, scarring, and overall gets them back to work and back home to their families quicker and safer, in my opinion. This is a patient 10 days after surgery. You can barely see the incisions. This is a benefit of doing minimally invasive surgery. So the question is, who does not qualify? Patients that should undergo weight loss surgery are ones that are optimized, that understand the risks and benefits, that understand the changes that have to be made. And people that don't qualify usually are people with severe untreated heart disease, lung disease, or liver disease. Any uncontrolled mental health issues like bulimia, schizophrenia, any addictions need to be addressed and optimized prior to surgery. And generally, people that are too sick to tolerate general anesthesia. People have to be willing to make a change. And there's programs are there for a reason to make sure that we choose patients that understand that we are going to be changing their body. And this is not a magic bullet. You still have to work with these kinds of procedures, but when someone's ready for it, it can be absolutely life-changing. So what to expect when you're starting to join a program? On average, it takes about 3 to 6 months to get to your surgery date. Most people leave the hospital in about 1 to 2 days, and most people go back to work in about 1 to 3 weeks. Again, it depends on the patient's return to work and their recovery. Usually the thing that determines that is their history. People start at different ways. People have to lose different amounts of weight. So everyone has a little bit of a different recovery. Sitting down with your bariatric surgeon, optimizing yourself prior to surgery is very helpful in order to try to have the best recovery and the best surgery transition. So what can you expect when you start a weight loss program? You have initial consultation with the surgery team. It's very important that we reteach our patients how to diet, how to exercise. All of our patients also get an endoscopy where we look at the stomach to make sure it is healthy. We also want to do blood work. Certain patients have issues like thyroid conditions or diabetes or untreated. We want to make sure we know exactly where our patients are starting from, and we try to get them as good as we can prior to surgery. In addition, all of our patients undergo a psychiatric or psychological consultation to make sure that their mental health is optimized. They have a pre-op visit, a pre-op class. They go on a special liquid diet before surgery, and then surgery days there. Again, we really focus on a team approach. We have multiple physicians, dietitians, coordinators that we work with. So focusing on that is very, very important. A team approach is essential when it comes to treating obesity. And it's also important to make sure when you select a program that they are a program that is a center of excellence. We have multiple designations. We've worked hard to maintain these. In doing so, it just shows that we meet the different bars that are set for these programs to be maintained. So we have our data tracked, and the most important accrediting body is really something called the ASMBS, and they're the National Institute of America that basically accredits bariatric surgeries. So by meeting these standards, our patients are all enrolled in a database. We continually involve our data monitors to look at our data to try to improve our quality. Our program is constantly being reviewed, and going to a program that is MBSA QIP certified generally leads to a more experienced team and hopefully better outcomes. So the best part of weight loss surgery is the outcomes and the patients, and watching people improve over time is the most gratifying thing that I can tell you that we get to experience as a weight loss surgery team. It's amazing when someone's ready for a change, when you give them this tool, how they can improve. So if you have any more questions, we have multiple platforms available, either online, social media, or website. And if you are looking for a change, weight loss surgery could be an amazing thing, but please take your time, shop around, make sure you're happy with your team, and it's a life-changing thing and can be incredible. Thank you again.